My name is Kurt Weiss. I am an assistant professor at the University of Pittsburgh. I'm a musculoskeletal oncology surgeon scientist, and I direct the musculoskeletal oncology laboratory within the Department of Orthopedic Surgery at the University of Pittsburgh.
Thank you, Dr. Weiss. We really appreciate you talking with me today at the end of the CTOS 2017. Thank you so much.
You're welcome. It's my pleasure.
And I'd love to hear your thoughts on clinical trials for leiomyosarcoma and what patients should know.
Sure. Well, patients should know that going on a clinical trial doesn't make you a guinea pig. It makes you courageous, and it just sends the message very clearly that we don't often know what the best thing to do is, and we're still always trying to find a better way. So if your medical oncologist talks to you about a clinical trial, you should make sure you try to keep your ears open to that and be open-minded to that.
Very good. And about LMS treatments, what's on the front lines right now in terms of immunotherapy? What's on the horizon?
I would say right now the most exciting thing is the SARC-28 study. The University of Pittsburgh is the lead center for that under Dr. Melissa Burgess. And this is an immunotherapy trial. It's the biggest immunotherapy trial in sarcoma right now. So that's kind of the new hotness going on right now. We won't know for several years until all the data comes back how successful it's been, but the preliminary data is looking very positive.
That's great. What about aldoxorubicin on the horizon and its usefulness and potential to be combined with olaratumab? Is there any information on that?
Well, anything that we can do so doxorubicin is obviously very, very toxic, and we give it to our children with osteosarcoma, for example, all the time because they can tolerate it. When you've got an older patient who might have some cardiac problems, that becomes a big issue. So you've got a wonderful drug that you'd like to use, but you can't. So anything that allows us to use that drug even a little bit, or that can diminish the systemic toxicity, is something that is going to be very positive for sarcoma patients. We've been using doxorubicin for 30 years, but there's a reason why I've been doing that, because it's effective.
Okay. And how about molecular alterations analysis? Does it point in the direction of a treatment option, expansion, or enhancement?
So we're going to have to rely on the centers that are doing high throughput genetic sequencing on all of their patients and learn from what they teach us. Not everybody is set up to do that. Not everybody has the capability of doing this. So until we know that it points to targeted therapies that are effective, we're just going to have to wait to see what the scientists tell us about it.
Okay. And the last question is genomic profiling. Is that integrated as a standard of care here?
It is not. I don't know if it's the standard of care at many places. It's very cost and labor intensive. So again, I think we're going to have to rely on the centers that have decided that they're going to make that a priority, and they're going to do high throughput genomics on all their patients and learn from what they tell us.
Thank you so much, Dr. Weiss. This was very insightful and I think very helpful for our patients to be aware of your perspective. Thank you so much.
You're welcome. My pleasure.